Hi, I'm Alisha from AdultSpeechTherapy.co. In today's video, I wanted to show you what I have on my clipboard. So I know it's tough when you first go into the field or if you're going back into the field of medical SLP and trying to figure out, like, what do I keep on my clipboard throughout the day? So I use a basic clipboard and I just wanted to show you guys what I have on it. So I know I've seen the clipboards that encase and you can put things in them, super helpful. I personally wear scrubs at work, and so I just keep a lot of things in my pocket, such as a pen light, pens, markers, highlighters, those sorts of things. But if you have a clipboard that is able to open up, fantastic. Some of those even have calculators on them. They're really great as well for use. So for me though, I just have a basic clipboard and I thought I'd zoom in on what I keep on it on a day-to-day basis. So first off, I always have lots of blank paper, really helpful to generate patients' writing, also taking notes during evaluations, and just treatment notes. So always have lots of paper. After I have my stack of paper, I typically have different screeners that I will use with patients. So I have the SLUMS, one assessment form or screener. I also keep several copies of the MOCA. Another screener form that I keep on there is the MS aphasia screener test, along with the assessment booklet. And it has all the written instructions for patients to read. Other things that I keep on my clipboard is just general patient caregiver educational forms, such as what is dysphagia? What is dysarthria? I have a slew of those forms that I've personally created. I also grabbed some from the workbook that talk about what is aphasia, what is dysarthria, what is apraxia of speech, those things that are really important to help our patients in the moment, educate them, as well as family and caregivers who are interested in knowing and will benefit from the education. Also on my clipboard, I keep swallowing exercises. So whether you print them from the workbook or generate your own form, I like to have those, and then I can check off the ones that I want to give the patient right on the spot so it's ready to go for them. I also keep a MASA, which is a screener as well, or the MAN used for swallowing assessments. In an old handbook, the Home Health SLP handbook, there's a Fraser-free water protocol that I use that form. There is also an updated form in the adult speech therapy workbook that I use. So I have several copies of those. If I feel a patient is appropriate for that, I will provide those. Then more tools that I keep for just on-the-go assessment. I have from the adult speech therapy workbook, I keep a large receipt that they can read and look at their reading comprehension levels. Also on the back side, I print a prescription label to see, problem solving, overall executive functioning abilities, reading abilities, even looks at visual and neglect. I will keep several copies of the eating assessment tool, or EAT 10, if the patient is able to fill this out. And sometimes I'll also keep the voice handicap index, VHI 10. So those are always helpful. Of course, the classic cookie theft, great for looking at verbal expression abilities. And on the back side, I have the source of Alzheimer's and dementia safety. Looks at safety and overall just ability to look at a scene and problem solve. So it's a great one to use. And you're probably noticing that a lot of my pages, I put in these plastic protectors just to keep so I can wipe off when a patient has touched them so we can keep things clean. I have my own personal alphabet in large font along with numbers and functional phrases that I've laminated that I use if a patient is nonverbal, unable to communicate verbally. So this is a great resource to use. Generate your own. Also in the adult speech therapy workbook, there's been one generated that I keep, and it is just the basic needs board. So pointing to basic needs. I love to keep this picture, again, in the adult speech therapy workbook, is the dysphagia labeled at the top, and just shows a basic diagram of the larynx, mouth, and just can give a basic anatomy so you can provide that education of what's going on in the swallow with your patients, caregivers, family. I keep the classic rainbow passage, great for voice, language, a variety of things, fluency, so that's a great one to keep. On the back side of it, I also keep the FOIS or F-O-I-S scale. I keep pictures, so when I talk to a patient about what swallowing exercises I'm prescribing them or recommending, I have a diagram of what it looks like if they're more of a visual person. I also like to demonstrate it for them, but this is very helpful as well. Since I am LSVT certified, I do keep relative voice loudness levels just for patients with Parkinson's, or if I feel they'll benefit from an LSVT based program. And then I like to keep on my clipboard, which is not just for assessments, but obviously for treatment use, is a semantic features analysis word web. And so I keep that on here. And again, you can find this in the adult speech therapy workbook, as well as the home health SLP handbook. And this is over here, the PCA or phonological component analysis web. And I like to use that for aphasia treatment. Last but not least, I like to keep just a basic diagram of, if I'm having confusion about, okay, is it this abbreviation, or what kinds of cues levels, or even it does have some diagrams, is this. And again, that's also available online on our blog. And so this is just a great resource that talks about all the different medical abbreviations, different parts of breathing, swallowing. And so this is helpful when writing your assessments, treatment notes, even education for patients. So that's just a little bit of what I carry. Obviously, while I'll be in treatment, I'll add more forms to it. I sometimes get compiled of different exercises I'm working on, different tasks, and the clipboard gets bigger, but that's in the main majority of what I use. So, I just really like to make sure I have a good pile of everything that I will be able to evaluate with on the go. If I'm in a treatment, I'm able to switch gears on the go, and just making sure it's comprehensive. So for any more questions, you can always send us an email and let me know your thoughts, or if you have questions about what are those forms you're using, send us an email. For everything else you need, including free PDFs, check out adultspeechtherapy.co.